Hi, and welcome back to this on-demand training regarding succession planning in health centers. This training is brought to you by the Health Center Association of Nebraska, also known as HCAN. For more information, please click on the link below. So let's get started. What we're going to learn about today is why succession plan is important in health centers and some best practices for succession planning. So let's see why it's important. Well, it's important because it proactively allows a health center to plan for talent changes. Maybe you've identified some workforce trends. Maybe there's some workforce turnover within your key management team. It also identifies some skill gaps and training needs, and it can boost morale and retention by investing in employees. It really does help to retain institutional knowledge and allows employees to grow within the health center. Remember that lack of planning can really put stress on employees, which may hinder the culture of a health center. So let's look at some key considerations in succession planning. First and foremost, it really is a long-term process. Succession planning doesn't happen overnight. We really need to start discussions before vacancies occur, and it's important to find the right individual that demonstrates qualities which matches your health center's mission and vision. Part of the process can be to review your health center strategic plan, your goals and objectives, and finally, looking at your financial, clinical, and operational goals. Another key consideration would be to look at internal candidates because they really can be the key. As you know, as health centers, we are recovering from the pandemic. And the pandemic did not cause workforce problems. It actually revealed what we already knew. It revealed that we need to recognize talent within our health centers. We need to nurture that talent and, if possible, promote from within. And one of the ways we can do that is to create a mentorship program as a pathway for growth. This really does demonstrate a commitment to employees and also a sense of loyalty and motivation to stay working at our health center. And finally, it really does allow high-performing individuals to grow and less likely to seek employment elsewhere. Another key consideration of succession planning is to decrease confusion during the transition. As you know, employee transition, especially within key leadership positions, can really cause anxiety and stress for the team. Think about this example. Let's say that your health center is in the middle of a construction project and trying to manage the loss of the CEO position. Having a succession plan really allows the health center to continue to move the construction project forward to be completed on time because there was a workflow process in place to name an interim CEO and ultimately start the search for a permanent CEO. So it's really important to have a succession planning policy and procedure, which discusses the roles and responsibility of the board, which position will assume the interim role, a procedure for recruiting for the vacancy, and then finally, how to address any community stakeholder or concerns. Some key considerations, really, when we think about succession planning, there is long-term success because we know that vacancies can happen at any moment. And, we can even add succession planning as part of our health center strategic plan. And then it will allow our health center to continue to focus on providing high, exceptional patient care, focusing on operations without worrying about who will lead the organization. So here are some takeaways. When you think about succession planning, it really does demonstrate a commitment to the health center's future. It alleviates the undue anxiety and stress of employees so they really can focus on their job duties. It provides confidence to stakeholders, community members, and even your board so that there is a plan to ensure longevity and financial viability. And finally, most important of all, it's actually a best practice for good governance. Here are some resources that will help get you on your way. Please note that the first bullet, the NAC CEO Succession Planning, a toolkit for health center boards, actually has a sample policy and procedure for succession planning. Thanks so much. If you have any questions, please feel free to reach out to HCAN or let me know. Have a great day.